All right, let's talk about Ozempic on the Elias Macko Show. Now, the popular weight loss drug used mainly to treat diabetes could become much cheaper and more accessible in Canada after its patent expires in January of next year. This could allow generic versions to enter the market, lowering costs for patients who currently pay hundreds of dollars monthly. However, experts warn this could also lead to increased misuse and side effects, especially if online clinics prescribe it too freely. Let's head over to Dr. Christopher Labos, cardiologist, degree in epidemiology, and a frequent contributor right here on CJAD. Dr. Labos, welcome back to the show. How's your summer going?
It's going very well, Elias.
Now, as a doctor,
yes.
do you have Ozempic fever? It seems like it's all the rage.
Well, it's all the rage for a very important reason. I mean, you basically previously had a condition for which there was no treatment, right? Go back 10 years, if you had a patient who had obesity, basically none of the medications worked very well. And then with the arrival of this new class of medications, originally liraglutide, which was, sort of effective, and then semaglutide, which was Ozempic, the reason why we're talking about it is because it is actually effective, whereas previously weight loss medications were essentially pseudoscience. They were sort of like very equivocal. They had a lot of side effects and only sort of very, very sketchy physicians prescribed them. Whereas now this is a standard medication. So do I have Ozempic fever? Yeah, because now we can actually treat a problem that previously was essentially untreatable.
But who really needs it? I have to lose 10 to 15 pounds. Right. I openly admit it. I got a belly. I wish I could get rid of it. I have trouble with it, right?
Right.
Who really needs to use a product like Ozempic?
The people who need to use this are the people who have the metabolic complications of obesity. So if you have obesity, and, we can quibble about how you want to define it, whether you want to use BMI or not, whether that's an accurate measure or not. But basically, anybody who has obesity above a certain threshold, and we usually say a BMI of 30, I mean, some people say if you want to be more conservative, over 35, but you have a lot of excess weight, and it's starting to cause you health problems. So like high blood pressure, diabetes especially. I mean, don't forget these were originally diabetes medications, cholesterol to some degree, if you have an active, history of heart disease or prior history of heart disease. Because the benefit that we've seen with Ozempic, because it's not about weight loss. The reason why we're doing this medically is not because we want people to lose weight, but because we want to prevent cardiovascular events. That's what the data shows, and that's what's been proven. Now, there's a good reason to also think that if you can manage obesity, you won't have as much arthritis later in life. There is good reason to think and suspect it's also going to decrease the risk of cancer, because there's a number of obesity-related cancers. So you're really doing this from a disease prevention threshold if somebody's at high risk. If you're just trying to lose 10 to 15 pounds because, you recently had a kid and you can't exercise as much as you used to, well, that's your own fault for reproducing. Haha. But, this is not for the people who just want to lose a little bit of weight. These are for the people who actually have a chronic condition, which is obesity.
Now, Dr. Labos, it almost sounds too good to be true. Like some of the reports you read, okay, it's diabetes and obesity and cravings and addictions and all of this stuff. Is it too good to be true?
I don't think it's too good to be true. I think we're going to see how effective it is in different situations. And it's hard. It's a hard medication for some people to tolerate. The big side effect and the big thing that is a limiting factor, which is true not just of Ozempic, but all the drugs in this class, is that it causes a lot of nausea and vomiting and GI upset, gastrointestinal upset when you first start it. And so there is a way to go about it. There is a way you start at a lower dose, you increase it slowly. If you start to get side effects, you come down on the dose. So there is a little bit of adjustment that has to be done. You have to sort of warn people about it and dose it properly. But if you do that, it is a manageable side effect. But there are going to be people who try it and who are like, nope, I can't tolerate the side effects. Now, this is true of all medications, but it is true of Ozempic as well. So you have to understand what its limitations are. And for some people, the benefits are going to be a lot less pronounced than what they're expecting. Like if you go into this thinking that you're going to lose 75 pounds and be back at the same weight that you were in high school, that may not happen. Because from the medical point of view, if you can lose as little as 5 or 10 pounds, that's going to make a significant impact on your health. Like you might be able to start decreasing blood pressure medication. You might not need your CPAP machine if you have sleep apnea, right? You can have a lot of medical benefit with relatively little weight loss. And that's the other point that we have to hammer home to people. This is about a medical intervention. It's not about aesthetics, and it's not about achieving a specific number on the scale. So you may not lose a little weight and you might be disappointed, but your physician might actually be very, very pleased with the progress that you've made.
Talking Ozempic with Dr. Christopher Labos. So the fact that this drug will be available in a generic version as of January, how much of a game changer will it be when we have a generic version?
Well, we'll have to see. There's a few wrinkles here. And just, small parenthesis, the story of how the patent expired is a really bizarre one because Novo Nordisk basically in 2018 decided it was going to stop paying the renewal fee on the patent in Canada for no seemingly logical reason. They just decided they were going to stop. And only in Canada, not in the U.S., not in any other country around the world. They just decided they were going to stop paying the application fee for unclear reasons. So the patent looks as if it's going to expire. They do have about 6 months to do something in the court, so maybe something will happen, but we don't know. And there does seem to be another company that is willing to step in to manufacture it, at least in Canada. Now, we'll see if that actually happens. Big pharmaceutical companies have a history of sort of challenging these things in court, and sometimes they come to out-of-court settlements where they will pay off the generic manufacturer to not actually manufacture a generic version. So there's no guarantee it will come in January. But if it does, it has the potential to drop prices a little bit. Now, the question is, how much does it drop prices? If it drops prices by 25%, that'll make it more affordable for some people, but it may not be a game changer because it'll still be a little bit expensive. So it's going to be very interesting to see how many generic manufacturers come into the market, how much the price drops. At least in the short term, though, the price may not drop that much, but it will make it a little bit easier and a little bit more affordable for people who need it, because right now, the big problem is government and private insurance companies tend not to want to cover it for purely weight loss purposes.
What a scientific experiment that would be, huh? If Canada ends up as the country that has access to a generic version that's cheaper, if you end up seeing significant difference in health outcomes because it's available generic. Any concerns about what's happening online with drugs like this, where it seemingly you can get prescriptions and stock of these drugs in a easier way?
Yeah, that's a big problem. I think we were talking about this. I think last year there was this online clinic somewhere in Quebec. I can't remember if it was Quebec City or not. But basically, people were logging on, getting prescriptions, never even interacting with a healthcare professional, right? They were just basically filling out a form and getting a prescription. That's clearly inappropriate, right? I think, look, and I understand why, governments are always, a little bit worried about a new medication that's very expensive because you don't want it to be prescribed to, every Tom, Dick, and Harry for inappropriate reasons. So you do need to have some degree of controls. But this system already exists in this province. We already have a program called Médicaments d'exception, Patient d'exception, where you have to justify the use of expensive medication. So it's not as if we need to reinvent the wheel about how to apply this. I think these medications should be covered as part of the drug plan when they are prescribed for medical reasons. And I think the government absolutely needs to crack down on some of these online clinics that are handing out prescriptions for no seemingly logical reason. So, we don't have to veer very far to either extreme. We can have a sensible approach where we use what is an expensive medication to treat a chronic problem. And don't forget, we do this all the time. Chemotherapy drugs are very expensive. There's a lot of stuff that we give that are very expensive, but we give them to the patients who need them to treat the problems they have. And obesity is a problem just like any other. For a lot of people, it's something they struggled with their whole lives, and they simply just can't lose the weight. So we have to think of it that way. And you're absolutely right. The government needs to crack down on inappropriate use, but at the same time, it needs to support the people who are prescribing it properly.
I got to be quick here, Dr. Labos, a little over time, but I have listeners who have a concern, we don't know enough about Ozempic, and they're worried that, 5 years' time, we're going to find out that it causes X, Y, and Z. Do you have those preoccupations?
No, because, this same drug class has been around for years. Liraglutide, we've been using these medications for decades at this point. Semaglutide, the reason why Ozempic is a great one is because it's once a week as opposed to daily, but similar versions of this have existed for years and have been used for years, and we haven't detected any long-term side effects. This is not going to cause cancer or anything like that. That would be truly shocking and almost unbelievable.
Dr. Labos, always great speaking to you. Thanks so much for coming on today.
Thanks. Take care.
Cardiologist Chris Labos, frequent contributor right here on CJAD.